What's been the most amazing to me is how quickly things have progressed. I know that for families it will never be quick enough, but really to go from the identification of the gene by Huda Zogby in 1999 to the first mouse models in 2001, the demonstration of reversibility in 2007, AAV being demonstrated in 2013, and here we are in 2023 and we already have the first clinical trials underway. What makes it the most attractive is that it seems from the basic research that the brains of these girls are waiting for MECP2 to come back on, whether that be turning it on through the inactive X chromosome, adding it through AAV, or restoring it through editing. I think that the field will keep moving towards the recruitment of the endogenous RNA editing enzymes, which are known as ADARs. Relative to, say, DNA medicines, it's a relatively new field for pharmaceuticals, but I think that it will rapidly catch up in terms of the number of diseases that it can hit and the excitement around the technology. I also think that RSRT is doing a wonderful job of providing resources, whether that be cell lines or mouse models that are available to other companies without license restrictions that will enable them to start their own preclinical programs without having to do a lot of the independent groundwork. By funding these projects, even when they're in early stages and perhaps are not as open to being funded by, say, the NIH, they funded these projects and allowed them to develop. So I would say that without RSRT, the Taysha gene therapy project, as well as the neurogene gene therapy project, would not exist. What you're seeing here today is RSRT facilitating new potential partners and other groups who may already have started programs. And it's through advocacy and seed money and funding that these programs exist. What we hope is that it'll be what we see in the animal models, which is almost like an awakening where you have symptoms and then you don't. I think that having a therapy that even brings a reduction in symptoms for a CNS disorder that's monogenic will have a resounding effect and may renew interest in companies pursuing rare neurological diseases. And no one drug is going to hit a home run the first time, and so there's going to be improvements, and as they do, hopefully we're able to flip that switch and get the girls where they need to be.